When you go somewhere like an emergency room to seek care for whatever reason, you could come in contact with a lot of different people. And these folks have a lot of different titles. They have a lot of those different letters behind their names, and it can be really overwhelming. In some of the larger emergency rooms, and again, depending on the reasons that you're there and how sick you are, you could come in contact with or have anywhere from 6 to 16 different people helping to take care of you or involved in your care throughout the course of your visit. And this can be really overwhelming to people. It can leave anyone feeling confused. If you're aware that you're even there, you may not be, and it could be your family member or a friend that's there with you that's overwhelmed by just the sheer number of people that come in contact with you while you're there. So any information that you can get up front about these folks, what do all these titles, these numbers mean behind the names of the staff in the emergency room? Hi, my name is Andre Huey, and I'm a physician assistant. I work in the emergency room taking care of patients, and I've done this for several years. And I've entitled the name of this video, Alphabet Soup in the Emergency Room, because to some people, if you're not aware of what all these letters and titles mean, that's kind of what it can feel like, is alphabet soup. So I've dedicated this video for you to give you a brief description, to keep it simple, but to give you some information up front about who you're going to come in contact with in the emergency room and what their job titles are, what the letters behind their names mean. And that way, if you do find yourself in that situation, you'll have a little bit more comfort, a little bit more understanding about what's going on and who are all these people and what role do they have when it involves your health care. It's no secret that emergency rooms are busy, confusing, overwhelming places, and it takes a lot of people to take care of patients 24 hours a day, 365 days a year. So we're going to jump right into the video, and I'm going to discuss these folks, but not in any particular order of importance. But I'm going to start in the lobby because that seems as good anywhere to start. So when you first walk into a lobby, you're more than likely be greeted by staff, and in a lot of emergency rooms, you're going to first see security officers. Now, these folks have a lot of different roles in an emergency room and in the hospital, but in this particular area, they're going to greet you. They're going to make sure that your car is parked appropriately, that everything is out of the way for other folks coming in when it comes to your vehicle. And then they're going to screen you more than likely in the larger emergency rooms. They're going to screen you for weapons. And after that, after you see the security officer or after you go through that area, they're normally at the front end when you first walk into the emergency room. And then you're going to see them in different areas of the emergency room as well for the safety of you and the staff as well. Emergency rooms are stressful places, busy places, and a lot of times get pretty crowded. So we need the presence of the security officers there as well, just to keep everyone safe, keep everything in order. And again, they have a lot more roles as well throughout the hospital. Also, in the lobby of the emergency room, you're going to come in contact with someone sitting behind the desk with a computer, and they are the registration person. They're going to take your personal information and put it into the computer, the electronic medical record, and that's going to create a chart for you. They're going to take your name, your address, phone number, confirm your identity, maybe update your insurance information, and they're going to create a chart for you that is going to carry with you throughout the course of that visit. Now, also in the lobby, there's a triage area. And in that triage area, you're going to see a registered nurse. And on their name tag, it's going to say registered nurse or RN for registered nurse. And he or she, they are going to ask you questions about why you're there. They're going to take your vital signs, which is your blood pressure, your pulse, your heart rate. They may do an EKG on you, and they're going to update your history in the electronic medical record chart that you have now. They're going to update your medications, your surgical history, and they're going to triage you. They're going to give you a classification of importance, I guess I should say, or acuity level, how sick you are. Everyone's important there, but just based on your symptoms and your vital signs and your age and your medical history, where do you fall as far as the acuity level in the emergency room in the triage process? And there's a whole nother video that talks about the triage process as you go through the emergency room, and I describe that just a little bit more. So just you can find that video in the playlist on my channel as well. You may also see a CNA or a certified nursing assistant. You may also see on their name tag, it might say ED Tech, and they assist the nurse. They have a lot of important roles in the emergency room as well, but in the triage area, they're going to be helping the nurse get you checked in. They may do an EKG on you, a heart tracing if you're there with chest pain or shortness of breath. They may take your vital signs for the nurse while he or she are asking you questions to put into the electronic medical record. Then they may transport you back to a treatment room whenever one becomes available for you. So that was a CNA or an ED Tech. And you're also going to see a different one of those back in the treatment area as well throughout your visit, and also a different registered nurse. And we'll get into that in just a minute. But also in the triage area, you may see a paramedic, and on their name tag, it may say paramedic, their name, and then paramedic, or it may say EMT, the letters EMT-P for EMT paramedic. And their job is to do very similar things as the nurse and the ED Tech. Get you checked in, do your vital signs, do an EKG. Some of the job titles do overlap as well, and they work as a team to take care of you, to get you checked in as well. EMT paramedics may also start IVs and give medications as well to help the nurses and to fulfill the orders that the medical providers have written for you as well. Also in the triage area, you may come in contact with either a physician assistant or PA or a nurse practitioner, or NP for nurse practitioner, and they are sometimes, especially in the larger emergency rooms, in the triage area, if it's busy, to go ahead and get things started. In some emergency rooms, they may be in person, and in other emergency rooms, they may be on the video screen for a telemedicine area to listen to the reasons that you're there. And if they're in person, do a physical exam, and then go ahead and place orders for you to get things started if there is a wait time in the lobby, so that things are moving along with your visit as well. So those are just the folks that you're going to see in the lobby as well, and you're going to see some of the same types of people in the back, although they'll be different folks in general. They'll have a lot of the same titles, and they're going to take over your care once you get into the treatment room. So let's fast forward. You've had your time in the lobby. If there was a wait time, you get into a treatment area, and now you're going to be checked into that treatment room. You're going to see yet another registered nurse, or RN. Again, it'll say their name and then RN or registered nurse on their name tag. And he or she, they're going to get you checked in the treatment room to get ready to see the provider. Now, they're going to ask you more questions to put into your chart. They're going to get you in a gown. They're going to put you on an exam table or a bed there. They're going to get you hooked up to a heart monitor and possibly start an IV for the medical provider. Sometimes they may even draw your blood just to go ahead and reduce the amount of sticks that you need there as well. You may see a certified nursing assistant in there helping out as well. It'd be different from the one that you saw in triage, and then possibly even another paramedic as well. So you can see how the numbers of the folks that you would see in an emergency room, especially the larger ones, really grows. Also in a treatment area, you're going to see either a physician assistant, different from the one that you saw in triage area, a nurse practitioner, or you could also see a physician. Now, this physician could say MD for medical doctor, or it could say DO for doctor of osteopathic medicine. Now, both of those are physicians. So you could see any one of those medical providers, and they are the ones that come in and they interview you, they examine you, and then they write the orders in your chart to start your process of workup. Or they may add to the orders if some were started in triage area. They're going to examine the results of that, and then they are going to be the ones to determine, do you go home with a treatment plan for outpatient follow-up and treatment, or do you get admitted to the hospital for either a medical admission or a surgical admission as well. And again, you can see how these numbers of people just continue to build in the emergency room, which can be really confusing for folks and overwhelming. So hopefully this is starting to make some sense. And if you ever do get in that situation, it'll be a lot more familiar with you as well. And I've gone through quite a bit of folks at this point. So I'm going to end this video right now and leave this video as part 1. And then there's going to be a part 2 also. And we'll take off with a lot of the other folks that you're going to see that are going to be involved with your care after you see the medical provider in your treatment room and after they've put in orders, just to give you an idea, again, of the number of different people that you're going to see there who could be involved in your care. But do me a favor, as we're ending part 1 of this video, put a comment in down below to let me know what kind of experience you've had in the emergency room. And again, as I always say on my videos, don't put any identifying information on the comments, just a generic comment if you've had an experience in the ER. And if you have, with this information, if you'd seen this video ahead of time, would it have helped you be a lot less overwhelmed in the emergency room? So put a comment in. Also, if you will subscribe to my channel, that'll be great. If you'll like and share this video, and I've put some links up above to other videos that I've made for you as well in the emergency room, and talking about the environment and processes that I think you'll really like. So I hope you enjoy those, and I appreciate you watching this video to the end. Thanks.